Hello, my name is Eliza Osborne.
And my name is Mary Timney.
Thank you for attending our Day of Scholarship presentation. Our project is titled Stockton Interprofessional Health Assessment Team, Improving Health Outcomes for Older Adults. Mary and I are student volunteers with the Geriatric Workforce Enhancement Project. This is an HRSA grant-funded project that serves the purpose of improving health outcomes for older adults by developing a healthcare workforce that maximizes patient and family engagement, and by integrating geriatrics in primary care. The goals of this project are to educate and train the primary care and geriatrics workforce to care for older adults in integrated geriatrics and primary care models, partner with community-based organizations to address gaps in healthcare for older adults, promote age-friendly health systems and dementia-friendly communities, and address the social determinants of health. We utilize the 4M framework to develop care plans for older adults. This is a visualization of the 4M framework. When creating an individualized care plan, each of the 4Ms are taken into consideration. They stand for mobility, mentation, medication, and what matters to the individual. Through the Geriatric Workforce Enhancement Project, student volunteers administer health risk assessments to older adults as an initial evaluation tool to learn about the individual through their 4Ms. An interprofessional team of students from various healthcare disciplines, such as occupational therapy, social work, and nutrition, work together to continue health risk assessments for residents and develop care plans, continue care plans for individuals who have previously been treated, determine current limitations for residents' quality of life, develop and implement groups for residents' areas of concern, complete one-on-one intervention with residents, and support all residents for improved quality of life and aging in place.
Looking at the methodology of this study, the interprofessional team, which included one undergraduate pre-OT student, one undergraduate social work student, and two graduate OT students, completed health risk assessments on residents living within an affordable housing community in Egg Harbor Township, New Jersey. The health risk assessments included 6 outcome measures and were based on the principles of the 4M framework. So the first outcome was medication management techniques and previous medical history that was gathered through interview. The second was mobility, and that was assessed through the timed up and go assessment. The third assessment was for cognition, and we utilized the mini-cog. The fourth assessment was for depression, and we used the patient health questionnaire, the PHQ-9, to screen for depression. We also looked at activities of daily living and instrumental activities of daily living through the CATS index and the Lawton-Brody for instrumental. After the initial evaluations, the interprofessional team worked together with the assistance of Dr. Prakash to develop individualized care plans for the residents that focused on their goals and areas of concern. These range from things such as technology use to medication management. Over the course of the remaining weeks, the team ran weekly group sessions on commonly identified areas of concern and provided additional one-on-one interventions that addressed personal goals for the residents. Overall, we were able to gather data on 10 residents over the course of the 10 weeks from October to December of 2021. The sample size was 3 men and 7 women, as displayed in our graph here. After the study was completed, content-based qualitative analysis was completed on the 10 residents. 2 graduate OT students worked together to analyze the key points of the care plan and follow-up notes to determine commonalities between residents. We have some of the descriptions of a couple of the residents here if you'd like to take a moment to read them. Overall, improvement was found in several common areas. Analysis of the care plans found 5 commonly identified areas of concern for residents: social participation, nutrition management, medication management, physical exercise, and technology use. Here in our graph, you can see the number of residents that had improvements that were noted in each of the areas of concern. It's important to address that some areas, such as medication management and technology use, did not have as many residents with improvements, and that was due to a decreased need for overall group intervention in these areas. So specifically, not as many people wanted medication management or needed medication management and technology use help. So that was something we addressed more in individualized care plans rather than our group sessions.
In conclusion, our research has shown that individualized care plans and group activities can increase social participation, exercise, and technology use in the older adult population. Affordable housing communities would benefit from programs and further research that focus on individualized needs.
Thank you so much for listening to our presentation. If you have any questions, please feel free to reach us at either of these email addresses. And here are our references. Thank you again, and have a great rest of your day.